country.
And let's kick it to the gentleman from Colorado, Jared Polis.
You know, and people wonder why there's such passion that this issue creates on both sides of the aisle. It's because this issue is an issue of life and an issue of death. One of my constituents from Boulder, Colorado, asked that her name not be used for her very personal story, but wanted me to share it with the people of the country and my colleagues in Congress. She tells us that she doesn't even consider her story unusual. Her sister was 62 and hadn't been able to afford health care for most of her life, even though she worked as a legal secretary. 60 years ago, her son, the niece of my constituent from Colorado, became very depressed. At age 24, he was a part-time student. He didn't have access to any health care, let alone the mental care he so desperately needed. And 6 years ago, on the night of July 4th, he went to a park and shot and killed himself. The devastation to her sister and their entire family, as many of us know, is beyond words, beyond explanation. Her nephew was as important. Isn't my nephew as important as any politician or rich person in this country? And that can be a question that any of us ask. She writes that health care is a right for all citizens, and there must be a robust public option. This could be any American family. We're talking about lives like the life of this young man, with mental health parity, with access to mental health services. He, first of all, could have been on a parent's plan up to age 26 under our plan. If he wasn't able to participate in a parent's plan, he would have gotten affordability credits to have his own plan, been able to get insurance through the exchange, including a public option. How many lives must senselessly end like this before Congress acts? The stories like this continue to multiply, and until Congress takes action, we're going to have more unnecessary deaths. And that's why people get so passionate about this issue. We're talking about lives and deaths. We're talking about our families. We're talking about people from across the entire country and what health care reform really means to them and their loved ones and their security. Yield back.
Well, let me thank the gentleman again. The